質詢，陳凱欣議員。
Ms. Chan Hoi-yan. Thank you, Chairman. The Hospital Authority (HA) is a statutory body receiving government funding for operation, and its expenditure and financial position have all along been a matter of concern in society. But at present, HA has not fully disclosed the detailed remuneration information on its key management personnel, thus depriving the public of a complete and accurate understanding of the remuneration expenditure for the relevant personnel. In this connection, with the government informed this council: 1. Whether it knows the total remuneration expenditure and the average rate of increase in the annual remuneration of HA's key management personnel over the past 5 years by post category, including the chief executive, cluster, chief executives, directors, and division heads of head office. 2. Given that according to HA's annual report, the basic salaries and other short-term employee benefits of key management personnel rose by around 6 million Hong Kong dollars in 2024 to 25 over the preceding years, with a rate of increase close to 9%. Whether the government knows the main reasons for this, including whether a personnel increase was involved, if so, of the post and numbers of personnel involved respectively. And 3. Whether it knows if HA has any performance indicators for reference when determining the rate of remuneration increase for the relevant key management personnel under the existing mechanism. If so, of the details. If not, whether the authorities will consider introducing the relevant indicators. Thank you. Secretary for Health. President. The Hospital Authority is a statutory body established under the Hospital Authority Ordinance Cap. 113. The members of the HA shall form its governing body with authority in the name of the HA to perform the functions and exercise the powers of the HA. The government provides funding to the HA annually for the provision of public healthcare services. Schedule 3 to the ordinance stipulates that the remuneration and the terms and conditions of employment of HA's employees shall be determined by the HA. The HA currently manages 43 public hospitals and healthcare institutions, 49 specialist outpatient clinics, and 75 family medicine clinics, employing over 97,000 people. The HA needs to attract and retain outstanding management talent to carry out its managerial duties. Among the employees of the HA, key management personnel are those persons having authority and responsibility for planning, directing, and controlling the activities of the HA, including the chief executive, cluster chief executives, directors, and other division heads of the head office. Currently, there are 15 key management personnel positions in the HA. The remuneration of key management personnel is determined according to the relevant policies established by the HA board, and they do not enjoy any variable components based on work performance. The total remuneration mainly consists of basic salaries and other short-term benefits. These short-term benefits include allowances and one-off payments for encashment of untaken leave upon retirement or departure from service. The annual pay adjustment for all HA employees make reference to the Civil Service Annual Pay Adjustment and takes effect upon approval by the HA board. On the other hand, in accordance with established policy, when the HA recruits new key management personnel, the remuneration of the relevant position will be reset to the starting point of the corresponding pay scale, which will result in a reduction in the remuneration of key management personnel. The HA has been strictly controlling the remuneration expenditure of key management personnel, taking 2024 to 25 with the most recent audited accounts as an example. After excluding the additional staff cost arising from a newly created key management personnel position, one-off payments for leave encashment of retirees, and salary increments granted under the established mechanism, the actual adjustment in remuneration expenditure for key management personnel in that financial year was 2.06%, equivalent to approximately 1.42 million Hong Kong dollars. In 2024-25 and the preceding 4 financial years, the average year-on-year increase in the total remuneration expenditure of key management personnel was only 1.6%, with a decrease recorded in certain years. In consultation with the HA, the consolidated reply to the question raised by Ms. Chan Hoi-yan is as follows. 1. From 2020 to 21 to 2024 to 25, the total remuneration expenditure of key management personnel of HA increased from 77.8 million in 2022-21 to 82.6 million Hong Kong dollars in 2024-25, representing an average annual increase of 1.6%. During the same period, the remuneration expenditure of the then chief executive increased from 6.2 million to 7.1 million, with an average annual increase of 3.5%. The total remuneration expenditure of other key management personnel increased from 71.6 million to 75.5 million, representing an average annual increase of 1.4%. Details are set out in Annex 1. To coordinate major capital works projects under the Hospital Development Plan, including the construction of Kai Tak Hospital and the redevelopment of Kwong Wah Hospital, etc., the HA created the new key management personnel position of Director, Development and Works in March 2024. The full-year financial impact of this position was first reflected in 2024-25. After excluding the expenditure related to the newly added key management personnel position, one-off payments for leave encashment for retirees, and salary increment granted under the established mechanism, the actual year-on-year increase in the expenditure on basic salaries and other short-term employee benefits for key management personnel in 2024-25 was 2.06%, equivalent to 1.42 million. As mentioned above, the HA has established a mechanism to strictly control remuneration expenditure. The annual pay adjustment of the HA makes reference to the civil service annual pay adjustment and requires approval by the HA board. Furthermore, the HA's established salary increment mechanism grants salary increments based on staff performances ratings. Specifically, employees are required to undergo a staff development review each year to assess their work performance. Only those who are assessed as having performed satisfactorily will be granted a salary increment. In addition to undergoing the staff development review, key management personnel are also required to participate in performance evaluation meetings for a more detailed assessment of their performance. Adjustment to the remuneration of HA's key management personnel have all along been made in strict accordance with the established mechanism. This remuneration mechanism balances the need to attract and retain talent with the requirement of prudent control of staff costs, helping HA maintaining a professional and stable workforce to deliver high quality and efficient healthcare services to the public of Hong Kong. Thank you, President. Ms. Chan Hoi-yan. Thank you, President. Well, the government increased its allotment to HA. It is over 100 billion. However, we have shortage of manpower and medical incidents currently happen. Today, frontline medical staff are still having heavy workload, and there is a rise in the charges as well. And now we know that the key management personnel is coming to another record high. It is as if we are living in parallel universe. My question is, the performance of the managerial personnel is directly affecting the quality of the frontline staff. And in your response, you said that there are KPI for assessment. What are the KPI? In which areas will you look into in order to allow a rise of salary? Can you tell us specifically what are the KPIs? Secretary. In order to more effectively review the performance of these staff, the HA has adopted a model of staff development review to assess their work performance. For the key management personnel, before participating in such meeting, they also have to submit a detailed work performance report. In the report, they have to stipulate the key working areas, and the actual key performance are being determined according to the scope of references. There are indicators as well as outcome being evaluated. They also have to report according to the challenges that they encounter. At the meeting, members will first evaluate such reports. If necessary, members will also further evaluate the outcome of such key management personnel. If required, they will also call for a face-to-face meeting so that they can have a comprehensive and objective evaluation. This is the regulations within HA regarding the key management personnel. Mr. Chen Chou-Guang, thank you, President. Just now, the Secretary has mentioned that these key management personnel do not have any bonuses. Will you take reference to the mechanism of MTRC? Perhaps 7 to 10% might be connected with the actual performance. Let's say if the waiting line remains too long, if they cannot achieve certain performance outcome. Mr. Chen, you can only ask one question. Secretary. First of all, according to the HA ordinance, the HA is empowered to determine the ceremony of their own staff. If necessary, they can take reference to factors apart from the civil service salary adjustment. They will put together a proposal, and it will be submitted for approval at HA board. Members have asked if there is any medical incident, will such outcome be connected to the performance and be included in the evaluation. In this regard, we will also continue to strengthen the accountability of each employees. We are also looking into to set up a two-tier responsibility system. For instance, if medical incident occurred, apart from the frontline staff, all the chief executive of each hospital as a key management personnel, they are also held accountable. They also have to report to according to the clinical safety of the patients. According to their performance, if necessary, there might even be penalty or punishment. We might also delay the increment in the salaries. These are some areas that we are considering. Mr. Stephen Ho, thank you, President. In the document, it was mentioned that you will take reference to the salary increment of that of civil service. Well, but I can only say that you are only taking reference to the practice. I'm not sure if it carries any values. Previously, there was an increment of 14.5%, and the 14 key management have been increased of over 300,000, which is average of a 5%. However, previously in the civil service, we are largely focusing on a pay freeze, and I don't see any danger of being poached by the private sector. The real threat is with the frontline staff because they only have a 2% of salary increment. This is a question from the public. Why are they having salary increments much more than that of the civil services? Is the frontline staff ever having a higher salary increment than the key management personnel? Can the department educate us? How can we respond to the public? Because we are being held accountable for being inadequate in monitoring the mechanism of salary increment of that of HA. Thank you. Regarding the salary increment of the past 5 years, in year 2021 to 22, we are having pay freeze. In 22 to 23, 2.5% increase. 23 to 24, we have an increase of 2.87% of increment. As for the 24 to 25, we have 3% of increase. 25 to 26, we have a pay freeze. It has been set according to the mechanism of the civil service. As I have explained, sometimes we have an impression that it is different from that of the civil servants because there might be some one-off payment of the encashment of untaken leaves. I believe this is why such impression is caused. Regarding the retainment of talents, this is an area that we focus on. So we will be providing different measures, either salary-related or non-salary-related, in order to retain talents. Members is asking the differences between the actual salary increase of that of the management personnel and that of the salary survey. Thank you. Mr. Chan Hoi-yan. Well, the questions included the basic salary as well as the one-off payment of the encashment of untaken leaves, and it has not mentioned how big an impact it is. Let's say if there was untaken leave 10 years ago and I only encash it till 10 years later when I retire, that will be a huge increase in the rate. Would the government consider to set a deadline of such encashment? Since we are having more and more retirees, I believe that this is an expenditure that requires certain control. Secretary. Well, regarding the encashment of untaken leaves, according to the regulations of HA, all the staff, including key management personnel, they will have 10 to 14 days of annual leave per year. The untaken leaves rolled over from the previous years, upon approval, it can be carried over to the next year. In case of retirement or leave of service post, it will be encashed according to the salary level. Just now, Mr. Chan has suggested the setting of a deadline. Your suggestion is well taken. But it is up to the HA to decide. Well, just now I have given you statistics of the previous 5 years. Both frontline staff and the key management personnel will follow the same mechanism. Mr. Julius Ho. Thank you, President. I felt sorry for Deputy Secretary because she is taking all the hit without enjoying the perks. I find this mechanism problematic. While your staff is having salary of up to 2 million, ranging from 200,000 to 280,000. As for the CEO of HA, they are enjoying 600,000 per month. As for the chief executive of the cluster, they are enjoying salary of up to 5 million. If you look at the hospital authority as a whole, on one hand, when they are adjusted according to the civil servants organization, but the pay scale is seriously deviated from the mechanism of that of the government. Well, at the beginning, it was being established as an independent body, but it turns out to be a burden of us. Maybe this is beyond your pay grade. Maybe you can not respond here. Hope you will consider it later and come back to us with an answer. Secretary. Well, the HA has over 97,000 number of employees. They are also managing 43 public hospitals and 49 specialist outpatient clinics and 75 family medicine clinics. They have a lot of issues to look into. According to the ordinance, hospital authority has the responsibility and rights to decide on the remuneration and terms and conditions of the employees and to be approved by the board. Well, there is an established mechanism monitoring all the setup of salaries. Mr. David Lam. President, I want to follow up from the question of Mr. Chen Cho-kwang. Well, from 2020 to 21, all the way till 2024 to 25, the directorate increase of salary is accrued at 8.6%. As for the key management personnel, is about 6.1% within HA. More importantly, the secretary said that they do not enjoy the payments that is related to the work performance. But still, you said that they will go through a staff development review as well as a performance evaluation meetings. So although that is not a performance-related bonuses, is it true that the increment will still be related to the performance? Regarding all key management personnel, the salary has a increment mechanism with an entry point and a maximum point. Every year, if the work performance is satisfactory, there will be an increment on a yearly basis. There will also be allowances. Well, for the bonuses that is related to the work performances, there is no bonus system across the whole HA. Apart from the allowances, they will have an increment on the salary, and it will only be released if the work performance is satisfactory. We will also make reference to the adjustment of the civil servants. Mr. Chan Pui-kong. Thank you, President. According to the Secretary, they will also taken into consideration of medical incident. However, to the general public, well, when they use the public hospital services, they hope that the provision of services can be speeded up. They don't want to wait for up to 1 to 2 years when they are signing up for a specialist outpatient clinics. Since the managerial staff is receiving such a high salary, is it possible for us to include such humble requests into the KPI to see if they are capable or not to shorten the waiting time of the patients? Thank you. Secretary, thank you for your comments. As I have mentioned, the HA is also looking into the feasibility of including a system of accountability into our remuneration system. In our reform, we will also incorporate a KPI into our system. Through a basket of measures, we hope that we can continue to improve the service that we provided, including the shortening of waiting time.
Question 4, Professor